Julabur is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Julabur can also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. It is best to take Julabur at the same time every day to ensure its effectiveness. Before starting Julabur, be sure to read the patient information leaflet provided by your pharmacist. The leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It's important to continue taking this medication exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle. It is very important to follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea. No matter what dosing schedule you use, it's very important to take this medication at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication. It may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row, and then take an inactive pill once daily for 7 days in a row. You should have your period during the 4th week of the cycle. If this is the first time you are using this medication, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Consult your doctor or pharmacist if you have any questions about using Julabur. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight changes, these are common side effects of Julabur. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. Be aware that Julabur may raise your blood pressure, so it's important to monitor it regularly and report any high results to your doctor. Serious side effects may include lumps in the breast, mood changes, severe stomach or abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes or skin. This medication may also rarely cause serious problems from blood clots, so seek medical help immediately if you experience symptoms such as chest pain, confusion, sudden dizziness, trouble speaking, or vision problems. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. If you are a smoker or use tobacco and are over 35 years old, it is not recommended to use Julabur. This is because smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. The risk of these problems increases with age and the amount of cigarettes smoked. It is important to avoid smoking or using tobacco while taking Julabur. As with any medication, it is important to consult with your healthcare provider before starting Julabur. The recommended daily dosage is to take one tablet at the same time every day, with or without food. It is best to take Julabur at the optimal time that works for your daily routine, to ensure consistent and effective use. Before taking Julabur, make sure to inform your doctor or pharmacist if you have any allergies to estrogens or progestins, or if you have a history of certain medical conditions such as blood clots, high blood pressure, diabetes, or thyroid problems. If you have diabetes, monitor your blood sugar regularly and consult your doctor if you experience increased thirst or urination. Also, be cautious if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit sugar or aspartame in your diet, as chewable tablets may contain these substances. Inform your doctor if you have upcoming surgery or if you will be immobile for a long period, as this may increase your risk of blood clots. It's also important to disclose all the medications and herbal products you are using before undergoing any surgery. Julabur may cause dark patches on your skin, so limit your sun exposure and wear sunscreen when outdoors. If you are nearsighted or wear contact lenses, be aware that you may experience vision problems or difficulty wearing your contacts. It's important to note that it may take longer to become pregnant after stopping Julabur, so consult your doctor if you have plans to conceive. This medication should not be used during pregnancy, and if you become pregnant while taking it, inform your doctor immediately. Lastly, Julabur may decrease breast milk production and pass into breast milk, potentially affecting nursing infants. Consult your doctor before breastfeeding while taking this medication. When taking Julabur, it's important to be aware of potential interactions with other medications. Some products that may interact with Julabur include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, increasing the risk of pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and some HIV drugs. It's important to inform your doctor when starting any new medication and discuss whether additional reliable birth control should be used. If you experience any new spotting or breakthrough bleeding, it's important to notify your doctor, as these may be signs that your birth control is not working effectively. Furthermore, Julabur may interfere with certain lab tests, potentially causing false results. It's essential to ensure that lab personnel and all your doctors are aware that you are taking Julabur. If someone has taken too much Julabur and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to seek medical attention right away if you or someone you know is experiencing these symptoms after taking Julabur. It is important not to share Julabur with others. Regular complete physical exams, which include lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear, should be done while you are taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It is important to keep all medical and lab appointments. It would be best to consult your doctor for more details. If you miss a dose of Julabur, refer to the product package for advice. You may need to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have any questions, ask your doctor or pharmacist. If you frequently forget to take your pills as directed, contact your doctor to talk about switching to another form of birth control. Keep Julabur at room temperature away from light and moisture. It's important to keep it out of the reach of children and pets. Make sure not to flush Julabur down the toilet or pour it into a drain unless specifically told to do so. When it's expired or no longer needed, be sure to properly discard it. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.